International nurse trying to do your NCLEX and you've been struggling and you don't know the way to do it. Today we're going to be looking at some of the tips or some of the things to set yourself for success. So if you're thinking of doing NCLEX as a registered nurse, those are the tips that we'll be looking at. So you're not alone. Many nurses really struggle when it comes to passing their NCLEX the first time. If you're an international nurse or foreign trained nurse and you're trying to do your NCLEX, I'm going to tell you some of the skills or some of the things that you need to do to set yourself for success. So one of the main things that when you think about it is fast studying. It's really important for you to keep time to decide, I'm going to study for 3 months or 4 months to prepare for it. So when you're studying, it's important for you to look at the concepts that are really tested in NCLEX. One of the concepts that is really common is because they give you a case study and then you have to think about prioritization. Think about, is the question asking for you, what is the priority action that you will take as a nurse? Another question that we like to ask is delegation. So you as a registered nurse, you get to do a lot of delegation, delegating to nursing assistant or delegating to LPN. So when you think about it, nursing assistant, they are unlicensed practitioners. And when you think about LPN, they're restricted in some of the things that they need to do. So you really need to know their scope of practice and the things that are not allowed. Different states are different. Different states might allow the LPNs to do some things while the other states may not. But remember, NCLEX for ideal world. So what do? Most of the things that they'll be testing are things that in different states that is practiced. So if an LPN will be allowed to administer some IV medications, but they may not be allowed to do critical medication. If you think about unlicensed practitioner, whether it's the nursing assistant or the paramedics or anyone who is not licensed, they are not allowed to give medications. So they might do some of the skills that are just tasks, like doing 4-hourly observations, vital signs, them doing a blood sugar, but anything that requires for the patient to be, when I think about what an LPN can do versus what a registered nurse can do, is LPN, they deal with a stable patient, a patient that you know the outcome, that there is nothing that is unexpected. So if you have a patient who is for admission, or you have a patient who is for discharge, or you have a patient that needs to be taught, or a patient who is unstable, that is a patient that you don't delegate to the LPN. When you think about the registered nurse deals with the tape, the teaching, the initial assessment, the prioritization of planning care, and then most of the time they evaluate the patients to make sure that the care that they planned, that the patient received the care. So when I think about the scope of the nurse as a registered nurse, I always think about it in terms of tape. That's teaching, that's assessment, that's to do with planning, and that is to do with evaluation. And then when you think about, so that's the delegation question. So most of the questions, when you think about delegation, they'll be asking you questions relating to things that you can delegate to the nursing assistant or the things that you can delegate to LPN. So if you think in terms of that, that will help you to wing the questions for delegation. So when you're dealing with questions, it's important for you to always think in terms of, is it a priority question? Is it a delegation question? And once you decide that, then you read your 4 answers. When you read your 4 answers, there is always 2 answers that are obviously so wrong. Then once you eliminate the 2 answers, you're left with 2. Then you ask yourself, when you're left with the 2 answers, what is the best answer? If I had nothing else that I would do, based on the question that I'm being asked, what would I do? So that really helps you to eliminate the one answer that is wrong, and you remain with the right answer. So that's how I was able to pass my NCLEX, by making sure that I read the questions, then I eliminated 2 answers, then I was left with 2. When I'm left with 2, I always ask myself, what is the question really asking? Is it a priority question? Is it a delegation question? And then one other concept that you really need to know is your pharmacology. Because remember, international nurses, sometimes we do struggle, and I really struggled with it. For me, I struggled with pharmacologists because the names are different. Their actions are the same, but the names are different. So you really need to know the names of your medications so that you can set yourself for success. So take 3 to 4 hours every time, study. When you do your study, make sure you take practice questions. I always start, usually when I was doing it, I started with 75 questions, then you go increasing it up to 150. And the more you do, the better it becomes. There are a lot of resources there for you to be able to do all. You can register with UWorld, you can register with Kaplan, you can use the textbooks to be able to read. And I'm going to link some of the resources for you to see.